for you in that time that you spent across both has been the biggest difference?
It's a very good question. To be fair, when you walk in the front door of the building, nothing.
Sure.
Healthcare, clinical standards, the standards of the staff and the consultants, you wouldn't know whether you're in public or private in terms of the care being given, to be fair. There is no doubt in terms of monitoring maybe efficiency or monitoring productivity and things like that. It does tend to be more focused on the private or voluntary side. But to be fair, we don't have some of the challenges that the public side have, which is more complexity invariably. They've also got a large teaching requirement. So that does tend to slow down lists. So, okay, we might do 10 lab colis in a day in one of our theatres. We might do 6 in a public hospital, but they've got to teach the next generation. They've got to look after and the more complex patients, etc. So there's some differences like that. Sure. And the other main difference, to be honest, is that unfortunately I was in the health sector along back in 07, 08 with the financial crisis. So then you're reducing staff and not replacing them, and service didn't get done. And all of a sudden waiting lists would be produced, etc. In the private sector, we don't do waiting lists. You've got to get through the work, and if there is a waiting list, you open the theatres longer, you work on Saturdays, etc., to get through that waiting list. So there's certainly little challenges, but at the end of the day, clinical standard-wise, we follow very similar standards and quality guidelines that are being created with the national programs, etc. And I suppose, thirdly, which I welcome, in the private sector, we subject ourselves to international accreditation.